Hi, my name is Alberta Henley. This is a PowerPoint teaching presentation of experiential learning using health belief model, Columbus State University, Spring 2020. Experiential learning, known as EXL, allows the student to have a transformation of knowledge by gaining experience, sharing, processing, generalizing, and applying the theoretical based design of the health belief model. This happens in the healthcare setting as the student attempts to meet the objectives of the assignment and accomplish goal attainments. The student uses HBM, which is health belief model, as it reveals the perceptions of the patient. The student is presented with different scenarios related to the health beliefs of the patient and predicts the behavior modification. The clinical setting is a medical surgical unit. I envision and believe application of HBM in this targeted patient population will assist in promoting positive patient outcomes. The objectives are constructed using the three domains of learning in Bloom's taxonomy. These are addressed as follows. Using experience and observation learning in the clinical setting, the student will evaluate, analyze, and write revisions of the components of the health belief model and integrate as evidence-based practice for the type 1 diabetic patient. The health belief model assists in predicting behavior change. With the student using the revised health belief model, the student uses communication skills to educate, sympathize, and empathize. There are several components of the health belief model. I will focus on the ones in red. Perceived severity of the patient. My family members had high blood sugars, which led to amputations. The student empathizes and then educates the patient by stating, uncontrolled blood sugar levels can lead to nerve damage, insufficient arterial circulation, and development of diabetic foot ulcers, all of which may end with extremity amputations. The perceived benefits by the patient is having improvement in quality of life. The student educates by stating, implementing measures to deter the consequences of noncompliance is monumental. The health belief model is utilized to weigh the positive perceptions and the negative perceptions of the patient, which elicits a predicted behavior change. The graduate student during clinicals has developed rapport with the patient. It is predicted by the health belief model a behavior change of the patient is wanting to be compliant with diabetic care. The student has gained experience and observation in the clinical setting and educates the patient by stating being compliant with diabetic care decreases the consequences of multiple admissions to the hospital, loss of limbs, and loss of life. The student also sympathizes with the patient and says, type 1 diabetes is a taxing disease, and there are daily challenges related to this illness, but taking one day at a time eases the burden. The SMART tool is used to assist the instructor in developing goals which are directly linked to the objectives. The goals are listed as the graduate nursing student by the end of the 12-hour clinical day of 4/10/2020 at 1900 will have evaluated, written revisions, and integrated 4 out of 6 components of the health belief model using experiential learning.